living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Social factors such as income, education, and a person's environment contribute to major diseases and decrease life expectancies. What exactly does this mean, and what are healthcare providers in our area doing about it? Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Sarah Medley, your host. Stay tuned to learn how healthcare is changing to address social determinants of health. Welcome back to Healthy Living for Life. Joining us on today's show is Ben McGow, Behavioral Health Program Supervisor at Pureview Health Center. He's going to talk to us about social determinants of health. Thanks for being here, Ben.
Well, thank you for having me.
So what are social determinants of health?
So according to the World Health Organization, social determinants of health is basically associated with the conditions in which people are born, grow, work, live, and age. All of these factors are represented on a variety of different levels, such as key economic stability, education, social and community context, health and healthcare, as well as neighborhood and built environments. And to kind of put it in the context of the different areas or elements, economic stability might be associated with your employment, your food or your housing. Education is the different levels of education, from higher education or lower education, whereas an individual may have a degree or no degree at all. Also the language and literacy barriers that some individuals may have. Individual might be able to read or write, others may not. Other factors would be associated with the social community context. Example would be discrimination associated with an individual's race, gender, religious preference, or culture, and a person may have been incarcerated at some point in time as well. Another example of health and healthcare would be general access to healthcare resources. Individual may have a level of healthcare services in their community, others may not, that's provided at a further distance for travel. And associated with neighborhood and built environments, accessibility to good foods. That's one key thing. Crime or violence within their neighborhood. Also environmental factors that's built around them, and also the just general quality of housing.
That is quite a list. So talk to our viewers about some common social determinants that we might see in Montana.
So in Montana, we have a wide variety of rural areas. And within those rural areas, we have a clinic in Lincoln, Montana, that we see where individuals have difficulty with housing, in addition to finding resources for food at different times of the year, good food to eat, to improve their living conditions, as well as transportation. Transportation becomes a big issue, especially if they need to reach medical services outside their rural community. That becomes a challenge for them to receive that care that they need, as well as prescription refills. And that's one thing that we've actually started within our own clinic is providing prescription distribution at these locations.
So give us an example of how you or your staff might identify a specific need with a specific patient.
Okay. So for us, we are a federally qualified healthcare organization. And what that means is basically we are a community-centered facility, and we connect with patients to provide them services, medical, dental, as well as pharmacy and behavioral health. That's wraparound services for those individuals that may come in to see us. And with that, it doesn't really matter if they have insurance or no insurance at all. And in addition, we actually provide that wraparound services to provide the best care we can and get in their treatment.
So give an example of a service you might offer a patient that comes into your clinic. What would you try and provide for them?
So a person may come in to receive medical treatment, and while they're been, I guess, evaluated by their medical provider, they may actually determine that they may have a mental illness or they may be a dependent as far as an addiction. And during that conversation with the provider, they actually have a warm handoff that they provide assistance to make sure that they provide that care of behavioral health or mental illness for treatment.
So how about a success story? Can you talk about a patient that really you felt so good about helping?
Oh, of course, I can give you an example. We've had patients where they may come in, like a father that may have children, and he may have just recently just come in just for a medical checkup. And during that conversation, there's a motivational conversation that we will have with them, with their provider, and they determine, well, they may actually need some other assistance because during the conversation they find out that they have lost their job. And in that scenario, they may have lost their insurance benefits as well. So we work with them to determine what the best, I guess, means of treatment is for their positive outcome. And we have case management team there on site that provides that assistance and service, as well as there might be some anxiety or depression associated with losing their job, where we actually provide a warm handoff to speak with the patient to see if they would be receptive to receiving additional treatment for behavioral health needs.
Are behavioral health issues and needs covered by most insurance carriers?
Well, that's one thing that's growing nationally. You'll actually see where more insurance companies are providing that service because there is a need that they have determined over the years. And you'll see where individuals may have a higher deductible or out-of-pocket expense associated with some of these services, or even with their insurance plan that they have selected. And whenever that's the case, then we work with them to put them on a sliding fee scale to provide that service that's needed.
And if they can't pay anything, then what does PureView do?
Again, we work with them on a sliding fee schedule to make sure that we can provide those services and make sure that they don't have that stress level associated with their insurance.
Thank you so much, Ben. That was great information. We're going to pause here for a short break, and then we'll talk with a social worker about what a hospital system is doing for social determinants of health. Stay with us. Welcome back. Now I'm joined by Jocelyn Hubbard, a social work care coordinator from St. James Hospital. Thank you for being here, Jocelyn.
Thank you for having me.
Yeah, it's great. So we just heard from a community health center about how they deal with social determinants of health. You're coming from one of our larger health systems in Montana. Talk to us about what you do with social determinants.
Yes, so although I work for a large health system, SCL Health, we really are mission focused and driven to treat each patient individually, to look at each patient's needs, to address each of them in an individualized care plan, to make sure that we are addressing both their physical, emotional, mental health, as well as other social needs that might arise for them.
A clinical social worker or a social work care coordinator is not someone I typically think of as being involved in a patient's care. Can you talk to us about that role?
Yeah, so we wear a variety of hats in a clinic setting. Everything from, educating our providers and our nursing staff on what resources are available to patients, because they might not be aware of different food sources to help people who have food insecurities or housing options. So letting them know what resources are in the community, educating them, as well as then meeting with the patients individually, and assessing, talking to them. We screen, do universal screening in our clinic, so we meet with everyone and screen them, for all sorts of things, whether that's food insecurities, housing issues. Do you have insurance? Can we help you, connect you to that? Do you need transportation? Is that maybe why you're not getting to appointments? So we help with those, and then once we identify those needs or those risks that could affect their health and their ability to make appointments or to keep track of their health, then we kind of try to set them up with resources, and we do follow-up care and check-in calls, or make sure that we are doing really wraparound care of our patient and their families as well.
So beyond the social care coordinator role, what other professionals do you work with to help these patients?
Yeah, absolutely. So in our clinic, we have, obviously the provider, which can be an MD, a DO, or maybe a nurse practitioner or PA. Their nursing staff, and then we have behavioral health specialists. So maybe that person's going to kind of step in and help more with depression or anxiety, or work with a behavioral health concern to address that might be affecting the person. And then we also can, we're moving towards having pharmacists actually in the clinic, to help when a patient is prescribed a new medication, to answer those questions with maybe the provider present as well, so they can talk about risks and benefits a little more, how it might, possible side effects, or how it might interact with what they're currently on. So they're not going to the pharmacy and hearing this stuff and then calling back to the doctor, that we can kind of address it when they're there and help them with that.
What types of issues are you seeing as the most common in the folks that you're treating?
So I work primarily with just OB patients, so mothers who are expecting, and pediatric patients. But I believe that what I'm seeing is probably what every person in my role is seeing throughout the state. We see a lot of poverty, a lot of homeless issues, a lot of food insecurities, lots of drug abuse, mainly meth, amphetamine, and bute. We see a lot of generational situations, so families who, have been involved in different systems. Maybe that's Child Protective Services for, their parents grew up in foster care and now they are. And so how to kind of help break that cycle and change it so that moving forward our generations are doing better and they're at home and not having the trauma affected by them.
As you're working in your own environment, what else are you doing with other organizations in the Butte area?
Yeah, so we connect with lots of social services organizations. I meet monthly with a variety of them. I meet with Child Protective Services, our home visiting programs that come in and do, nurse visiting. They do parenting education inside the home and safe care. We meet with, our housing people that are supplying our housing, and just try to connect and create relationships. So we work closely with Montana Chemical Dependency Center, which is the state chemical dependency treatment facility. It's located in Butte, so we try to coordinate care, and if they have patients that need care while they're there, they can come to our clinic and get medical care aside from their addiction issues as well.
How do you see this overall approach that you're doing, this combination of a whole bunch of different resources? How's that really helping the community?
I think it's, making an impact already, but I think that we have yet to see what wonderful things will be completed or accomplished with, this type of care, treating the whole person instead of, why you just have blood pressure. We're looking at the whole picture of the person, and we're having really great success, and we're seeing good outcomes. I think initially people are a little nervous if they have never experienced someone other than a doctor or a nurse at a clinic. They might think something is wrong, or they might be concerned about having this third or fourth person come in. But I'm hoping that the more that we talk about it, the more that it's just part of the care that they receive, and it's just standardized care, that they're comfortable and that we're able to help these people that maybe haven't been able to be helped in the past.
In the few seconds that we have left, can you quickly describe a success story?
Yes, absolutely. We've had lots of success. Like I said, I worked mainly with OB and pediatric patients. Recently, we were able to coordinate care with Child Protective Services, Montana Chemical Dependency Center, and help a woman who had never been able to parent successfully get into treatment. She was able to come to our clinic and get her obstetrical care done. She was able to complete her treatment. We were able to help the staff at MCDC and theirs to get her to a mother-child facility where she is now parenting her child without the involvement of Child Family Services. So, that baby probably would have been removed. So we are doing
great success story. Thank you for that great information, Jocelyn. Up next, we'll talk with Kristin Schuster, a healthcare transformation consultant with Mountain Pacific, about some of the big picture changes happening in primary care across Montana and elsewhere. Welcome back. We're joined now by Kristin Schuster with Mountain Pacific. Thanks for joining us, Kristin.
Thank you.
So we've heard from two providers about what's going on in their world related to this topic. Can you talk about some other things that are going on in the state and maybe even the national perspective?
Yeah, absolutely. We'll start with national. So I think one of the big things is just bringing light to the topic. There's been a big push from CMS and other organizations across the country about the importance of educating patients on the social determinants of health and creating national resources to help with those needs. From a community and a Montana perspective, the same thing is really happening. How can we work together as a state to address the different needs of the patients across our communities?
So can you talk a bit about the doctors and what led them to really focus on social factors that are impacting their patients?
Yeah, that's a great question. I think one of the big things is this person-centered and patient-centered care, which we're going to kind of talk about, I think, in a little bit, but really recognizing that you can't treat a disease, you have to treat the entire person. And a large portion of that is what happens to the patient in their day in and day out life, and those are the social determinants of health.
So you're right, patient-centered care, holistic care, those words get bandied about a lot, and they can be confusing. What does it really mean when a clinician is thinking about those terms as it impacts that patient sitting in front of them?
Mm-hmm. It's creating a partnership between the patient, the provider, and the care team. So in the past, the patients have been, you go to the doctor and the providers tell you what to do and then you go home. Now what we're really trying to focus on is bringing your goals as the patient into the care team and creating a plan for you that involves you, your family, and maybe some other caregivers in your life. So it's really important that at the center of all of the things that we're working with, that the patient is there and their perspective is really taken into account.
Earlier in the show, we talked about rural and the rural Montanans and how that can really impact the care that they receive. Can you talk about that a bit more?
Absolutely. I've just been driving across the state over the last couple days, and I think we forget how large our state is and how some of our communities are very small. And within those small communities, they may not have some of the bigger resources like we have here, in Helena or Bozeman. So the providers in those communities sometimes have to get a little creative with the type of care that they're providing. If you don't have a social worker, if you don't have a pharmacist in that community to meet those needs, what can we do? So we're learning to leverage technology and our ability to spread that across the state to really provide care no matter where you are in this great, beautiful state.
Earlier, we also talked about mental issues, behavioral health issues. How does that impact what's going on in our state and how providers are caring for their patients?
We're really seeing a shift. In the past, behavioral health has really been provided in a different area outside of primary care. So what we're really working on is bringing those behavioral health specialists into primary care and really making it that true one-stop shop for the patients.
Do providers struggle more with screening patients for social determinants? Is that more difficult for them?
I don't think the screening is necessarily the difficult part, but the identifying the resources that the patients need after the screening occurs is the hard part. So provider shortages and that kind of thing are something that we face across Montana.
There's a stigma sometimes around patients and the fact that they might need some mental health services. What do we do about that?
I really think lifting the veil is a huge part of that. So recognizing that just because you have behavioral health needs does not make that any different than maybe a need for diabetes. So never feeling like you can't ask your provider for help and recognizing that that's what they're there to do. So if that's what's important to you in the moment, it's critical that you bring that up to your primary care provider, but then also don't be alarmed if your provider is asking some of these questions that may feel like they're probing you a little bit. They just want to make sure that they're meeting you where you are in your healthcare needs.
We talked about rural, we've talked a bit about the mental health issues. What other social determinants might be unique to Montana?
I think our state is very large, and the vastness is a big challenge. So we don't have a very good public transportation system, especially for communities that are more rural. So one of the things that we're finding is that providers are approaching care in alternative ways. So if you're not able to go to your provider's office for a visit, you may be able to have a telephone visit with your provider or care team member. Maybe they'll be able to do a Skype or a FaceTime visit, or even come out to your house and do a home visit. So if you're having struggles getting to your provider's office, talk with them. They may have some alternative ways that you can seek care.
Are providers doing things to address these topics outside the clinic, for example, in the community? What are they doing in the community to help folks?
I think that's a great question. And what providers are realizing is they can't just work in the silo of their own practice or their own hospital. These changes and these social determinants of health really have to be addressed community-wide. So a lot of this comes with working with community resources, churches, schools, different organizations within the communities, and also across the state to really address these needs. So providers are making it a priority to ensure that they have the resources either in the clinic or within the community to address the needs that the patients have.
So in the minute that we have left, you've been doing this for a while, not terribly long. What major change have you seen in how practitioners are dealing with social determinants?
I think just gathering resources. So, I go into practices and they've got tomes of resources that are available for the patients. What they need to do is screen the patients to make sure that they're really getting them what they need. So they've got the resources, they've got the plan. All they need is the patients to be an active participant.
Thank you so much for that interesting information. And I would also like to thank Ben and Jocelyn. See you next week. In the meantime, stay fit, stay well, stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.